Home blood glucose checks will be the main tool to monitor daily patient control of diabetes. The closer the patient keeps their blood glucose to normal, the more likely they are to prevent diabetes complications such as cardiovascular disease, neuropathy, nephropathy, retinopathy, foot damage, skin conditions, slow healing wounds, and infections. For a normal patient, fasting blood sugar levels should be between 80 and 100. For a person who just ate, they'll be between 170 and 200. 3 hours after eating, they should be between 120 and 140. For the pre-diabetic, fasting blood sugar levels should be lower than 125. For the pre-diabetic who just ate, they should be under 230. 3 hours after eating, they should be under 160. For the diabetic patient, fasting blood sugar levels can be expected to be over 126. For a diabetic who just ate, they can be between 220 and 300. 3 hours after eating, they can be as high as 200 or more. Hypoglycemia, or low blood sugar less than 70 milligrams per deciliter, presents with the following signs and symptoms: shakiness, nervousness or anxiety, sweating, chills and clamminess, irritability, confusion, including delirium, tachycardia, dizziness, sleepiness, blurred vision, tingling or numbness, headaches, fatigue, anger, stubbornness or sadness, lack of coordination, seizures, and unconsciousness. Hyperglycemia, or abnormally high blood glucose levels, presents with the following signs and symptoms: frequent urination, increased thirst, blurred vision, fatigue, headache, and warm or dry skin. Before using the meter for the first time, and then again every few weeks, check your meter using a control solution. Control solution is only good for 3 months once opened. Label the control solution bottle with the date you open it. Check the date and shake the control solution before using it. The value the control solution gives should be in the target range printed on the strip's container. Check the date on the strip container for the expiration date and make sure the code on the strip container matches the code on the meter. Before you check your blood sugar, you should prepare your supplies. Supplies include your blood glucometer, testing strips, a lancing device, lancets, an alcohol swab, and a cotton swab.
The reason I'm using the sides of my fingers, it's the most accurate. And when you're using the sides, make sure you use either side, not the pad or the tip. Using the pad or the tip will hurt. The next thing I need is a lancet needle. I like to put my lancet needle directly into my lancet. It will only go so far down. Twist the top and take this off. Then go ahead and place the cap on. The cap has different size drops. Most lancet holders will either have dots or drops, or sometimes they're down here, or numbers. The larger the dot, number, or drop, the deeper that needle will go into your finger. So you want to turn this down to the lowest setting possible and still get a good drop of blood. Most lancet holders work on a spring, so I'm simply cocking this and it's going to be ready to use. The next thing I'm going to do is get my vial of strips, open it, closing it. These strips are very user-friendly, meaning I can touch them all over. The end with the lines is usually the end that will go into your meter. The side that has the little opening is where the blood will go. So pick up your meter, slide the strip in, and that will turn your meter on. Then you're simply going to wait until the meter prompts you or follow the pictures. It's asking for a drop of blood. At this point, I'm going to take my lancet holder and I'm going to hold it against the side of my finger. If you don't see blood right away, simply milk your finger to get an adequate sample. Once you have a good sample of blood, simply touch the strip against and it will draw it into the strip. And now I have about 5 seconds and it's going to give me a reading. And this is my blood sugar reading. Now you can get your record book out, and I would want to put my result in my record book. After that, I'm going to take my strip out of my meter and you can simply throw this away. Now my lancet, I want to use my lancet one time. I'm going to take my lancet out and I'm going to place this into a sharps container. If you have any questions about monitoring your blood sugar, please talk to your healthcare provider. Thank you.
Factors that can affect your blood glucose reading include illness, surgical procedure, stress, a dirty meter, outdated test strips that are not compatible with the meter, substances left on hands, temperature changes, a small or not large enough blood sample, and wet fingers. Diabetes lifestyle resources include Diabetes 24/7, My Health Advisor, Recipes for Healthy Living, and Dietitians. There are a variety of government and non-government programs that can help cover healthcare expenses for those who qualify. If you have private health insurance, they may be able to help you pay for your diabetic supplies. Government health insurance, such as Medicare, Medicaid, the Children's Health Insurance Program, or CHIP, TRICARE, and Veterans Health Care programs can also help. Medicare helps pay for diabetes services, supplies, equipment, and some preventative services for people who are at risk or have diabetes. This is a federal health insurance program that pays for healthcare costs for people who are eligible, including those age 65 or older, or under age 65 with certain disabilities. The following federal programs can provide resources for people with diabetes: the Department of Veterans Affairs, TRICARE, the Indian Health Service, the Hill-Burton Free and Reduced Cost Healthcare Program, the Bureau of Primary Health Care, Social Security Administration, Social Security Disability Insurance, Supplemental Security Income, Women's, Infants, and Children. State programs that can provide more resources for people with diabetes include the Medicare Savings Program, State Health Insurance Assistance Programs, State Pharmaceutical Assistance Programs. Local programs that can provide resources include the Lions Club International, Elks Club, and Kiwanis International. Independent resources for people with diabetes include the Partnership for Prescription Assistance, Needy Meds, RX Assist, RX Outreach, and the National Council on Aging.